honored to sit here with you because this is very full circle for me in that I get to sit here and talk to you. You know, you've been in this space for a while since you were a kid.
Yeah.
Right?
Yeah.
Like, how have you been able to just stay creative all this time in an industry that just evolves so much?
When you evolve as a person, well, this is what I would wish and hope for everyone. But when you evolve as a person, your subject matter should reflect what you're going through, or it should reflect what life is at that time. So whether it's the time or the energy of the country or where we are as, you know, society, I think music should reflect that, or, you know, your growth. I know there's a lot of rappers who've been rapping about shooting guns for over 20 years. And me personally, I get excited just trying new styles. So at first, initially, when hip hop started to deviate from lyricism, and, you know, the South came in and they dominated, I was a little annoyed at that because I spent my whole life learning how to perfect this craft. But it was until I got a chance to appreciate it when you could go in the studio and you don't have to have 1,000 words in that essay. You can actually enjoy the music and space yourself out and have melodies. So I appreciate the extra creativeness of what's going on today.
Yeah. So who taught you how to rap, right? Like, I know you have a family lineage. Your aunt is Robinson.
Yeah. I was listening to Audio 2. This was years ago. I was a kid and he was on like 98.7. That's when they were still playing hip hop. And I heard that, and my mom, she was out actually promoting Rapper's Delight. So when she came home, it was like 5, 6 in the morning. I remember the sun being up. I had a manila folder with rhymes on it. I wanted to rap. And my mother wrote my first rap. And she was definitely compensated with publishing, trust me, ever since then. But that was the first rap she wrote for me. And then after that, it was me working on myself, yeah.
And then what was it like for you, like, as a kid? Like, so you're surrounded by, like, this hip-hop royalty family, right? Like, I mean, Rapper's Delight is...
Yeah, but see, like, there was many generations in between the two. So when I'm a kid growing up with them, they look like old heads. That, like, you know, they look like Earth, Wind, and Fire and the old Jays to me. It wasn't like, you know, until I got older was I able to appreciate what they did. But when you were young, you see the Sugar Hill Gang, these guys is, you know what I mean? I definitely was appreciative of growing up with my aunt because I got a chance to have a good taste palette, and I got a chance to go to a lot of great restaurants that I might have took for granted growing up. A lot of people haven't been able to go to. And, you know, just my high class and my taste, I attributed from growing up with them, but I did everything on my own.
Yeah. I mean, growing up, just, you know, being a woman in hip hop is difficult. It probably was even more difficult like then.
And you don't get taken seriously. So my image, you know, the way I dressed, it came from, that's how, you know, the Brat and all of them were dressing back then in that era, and I just stuck with it. But I always had to prove myself more than the boys, or so I always had to write harder, and that's where the battle rap aspect came from. It wasn't like I was a battle rapper, it was just that I always wanted to prove I was better than everybody, and the only way to do that is to challenge them to a duel, you know? So
knock the air out of her. When I come through, I got the roof missing. Maurice come through, she got a tooth missing.
I don't use the word stubborn, but like we push through a lot of pain a lot of times. And I think that's a cultural thing for us. Yeah. Where we just endure, right? And we've built up this tenacity and strength. And maybe it's cultural. I see a lot of that even in this business, like with hip hop.
It's in our DNA, and the messed up part about it is that, you know, in the medical field, they think that when it comes to our pain, that we exaggerate, or that we can take pain more than other nationalities, and that's only because we've been forced to, and we've been forced to push to the limit. So I think that even, you know, just the striving, whether it be, like you said, in music and a career and entertainment, or whether it just be through life, like, we always learn to push through. It's been embedded in us.
Yeah. So, and I kind of want to circle back to, like, even the business, right? Because being a woman, I feel like you have to work triple hard than the guys, right? Like, what has that experience been like for you?
The experience for me has been nuts because I'm not only a female, but I also am part of what the box that they put me in of being, you know, LGBTQ, LMNOP 2+3. So that has been a factor because in the beginning of my career, when I was on Def Jam, it wasn't the best thing for everybody. You know, it wasn't that accepted how it is now today. And plus, you know, when you are female like myself, sometimes they don't care what I'm wearing, you know, and they will proposition you. And you're like, man, that's crazy. So, and just working hard. Like I work hard or harder than a lot of the guys. When I decided that I wanted to do the independent route, and I'm outside with the CDs, I'm selling thousands of CDs state to state. You know what I mean? I have strippers selling CDs with me. We're very innovative, but you know.
You got a new song come out recently, Praise.
Yep. Yeah. We got Praise. I worked on a full High Frequency album. I don't want to call it gospel or Christian. It's definitely giving praise to the higher being, but it's like I've done enough music in my career where I'm talking about guns and drugs and, you know, all type of things that really weren't gratifying or satisfying to my soul, and I don't want to give poison out to my people anymore. So yeah, for anybody who wants good vibes and good music.
Yeah, no, I like that you say that, and I think that's a big reason why we're doing this hip hop and health, you know, movement, is that we have to take our health seriously. There's things that we can do. I mean, having the opportunity to work with Dr. Puma here at SR Medical has been a godsend, in that, like, he is really committed to, like, helping people and making sure that they end up in a good spot. So I'm, you know, loving that we had an opportunity to capture your story. You're going to do the UFE?
Yeah, no, you guys are amazing. And I'm going to do the procedure, and I'm excited about that. And the part that, besides saving myself, the part that gives me such gratification is knowing that I could share this information with all of the other females who are going through it, like, that I know. So, you know, or they know me through social media. So it's like the rappers that I know, and so many people who could have prevented going for that partial hysterectomy and things. I hate that I didn't get this information sooner. But other than that, anybody who I can help with their fibroids, because I know what they're going through, I'm here.
Right. Hip hop and health.
Yeah. My anticipation, my anxiety is through the roof. I'm excited to get this done. This procedure has been long overdue. And sometimes, you know, when I say it, it almost took my life. It just goes over your head, you know, because everybody always exaggerates when it comes to that. But just to sit and think, if I didn't take that extra precaution, if I didn't take that extra step, if Dr. Puma and Kenya didn't step in, I don't think I'd still be here. And that right there, the gravity of that makes you really say, wow, I need to take care of myself even more. So this is a jump start to my new life. I'm gonna do better, and I'm gonna tell the world. Tell the world about what I experienced. You know what I'm talking about? Good morning. I'm not nervous that everybody has on nice Dr. Butcher outfits. I'm not worried about that. And you make sure you get the footage, and I trust everybody. Everybody's handsome here. I was telling Dr. Puma that's not right. They need to hire some people who weren't blessed facially. You know what I mean? And I see y'all on the other side. Like this same side though, like after the surgery, not the.
The entire procedure should take about 45 minutes. While this looks like an imposing operating room, it's actually the catheterization lab. This is X-ray tube equipment. And what we'll be able to do just from a simple intravenous here in your artery, after we've given you some sedation so you won't feel anything,
good.
We'll be able to put a wire and then a catheter up the arm, around the aorta, and down to the pelvis. And then through the catheter, we inject contrast dye and we take pictures. And all the pictures are going to be right up here on the big television screens. We will be injecting hydropearls. And those hydropearls then automatically seal that artery up, thereby stopping all the blood flow from these benign tumors that are causing you so much discomfort, distension of your abdomen and pelvis, and worst of all, those really low blood counts because of the heavy bleeding during your periods and then the intermittent bleeding between periods. So within a few weeks, those fibroids will shrink, and it's very simple. It's no water, no flowers. They just slowly go away. And within 4 to 6 weeks, you should have no more bleeding, back to normal periods, and your blood counts should slowly come back to where God intended them. And you'll be surprised how much better you feel. Do you have any questions?
Is it okay if I cry before your surgery?
You can do anything you want. Of course you can cry. We're just glad you're here, and we're glad we can help you.
You're good this early in the morning.
Thank you.
I got everybody up early in the morning, all right?
Does she get a cool outfit like Carlos too?
Only if she wants to come in.
Yeah.
Coach here, Carlos had to get scrubs, lead,
Yeah.
a lunch lady hat.
Yeah. All the things. But it's going to go well today. Oh my God. You're going to be great. You're going to be like a new lady when you get off the tape.
He was telling me.
Yeah. Well, listen, it's going to go well. I pray God's covering from Jesus' name and that God's angels will be in here with you guys and that they would anoint Dr. Puma and his tea.
Thank you.
All right. I love you.
I love you more.
All right.
I'm hugging you.
All right. All right.
You see the wire coming up, catheter following it, and we're going straight down the aorta, the descending aorta into the pelvis. Beautiful.
So what I'm doing here is just injecting. There's some contrast mixed with the hydropearls, so I'm able to see generally where they're going, so we can make sure that they're being delivered safely and on target.
Only into the artery that we want to close off. All the way. That's the entire artery feeding that fibroid. And we do these procedures with kind of advanced conscious sedation. We use Versed and fentanyl intravenous to take away the anxiety from the procedure and pain, and then propofol to make the patient a little bit more deeper sedation. It's not general anesthesia. The patient is not intubated or put on a ventilator during the procedure, but we have very close monitoring. Blood pressure, heart rate, oxygen saturation, respirations to make sure it's safe. Amazing result.
Beautiful.
All the branches are gone. Outstanding. Within 4 to 6 weeks, she should feel like she hasn't felt in 10 years since before she had these fibroids.
A lot of the reason why we're here today is because of a dinner that you and I had, oh my God, maybe a month, not even 2 months ago. So you had come on one of my other podcasts, and on that podcast, I don't know if you realize you mentioned this, but you started talking about fibroids.
Right.
So podcast wraps, we all go sit down, have dinner. You weren't feeling well, weren't looking great. And I was like,
Well, you were looking great.
You look great today.
I looped around. He's good.
He's
Okay,
good.
you were looking great,
Thank you. I love
But
you.
as a friend,
but maybe a little pale.
well, you know, you were a lot pale that day. You weren't your normal self.
Right.
And I was kind of picking that up in the spirit, and I could tell you didn't feel well. And when I mentioned to you, like, what were you talking about with the fibroid thing? That's kind of how this all came into fruition, right? In terms of like how you've been dealing with that and really kind of managing that for, how long have you dealt with fibroids?
I've been dealing with fibroids for the last 10 years.
Wow.
So back in 2014 is when I discovered that I had them. And my stomach, I was always chubby, so I just thought it was, you know, what it was. But then I found out that I was the size of a 9-month pregnancy. So at the time, the doctor was like, you know, I don't want to give you a partial or a hysterectomy. So he did the myomectomy, if I'm not mistaken, and they removed 17 fibroids. And the biggest one was like the size of a melon. So he told me to go have children. And I had to change my lifestyle. And I tried to like find a man, and I feel bad for straight women, but that's another podcast. But anyway, so it didn't happen. And then they reoccurred right around the pandemic. So I had a date set up, but I was very uncomfortable with the idea of it. And like you said, I prayed, and I was like, if it's not meant to be, I don't want to do it. And that week, COVID hit, and that week they had to continue to try to reschedule, but because it was so crazy, they didn't get an opportunity to. And I didn't put it on the back shelf, but I dealt with some serious life issues at the time, you know, so I didn't really get a chance to focus on my health the way I was supposed to. And then St. Puma and St. Kenya came in and saved the day. So I really appreciate you guys.
Well, you give us a lot of credit, right? But the biggest credit goes to you for like taking heed and paying attention, because as we were sitting there and we were having dinner, I was like, I got to text Dr. Puma, right? Because we had just had a conversation. Literally a week before, talking about how he was going to incorporate UFE into his practice. And I was like, I know a guy. And he was very responsive. And she ended up here at Soar Medical.
Well, first of all, thanks for sharing your story. So you are pretty focused as far as I'm concerned, and you're pretty amazing, all the things you've accomplished. But telling your story, we think is going to help a lot of people, because your story is not that unusual, to be honest with you. Even falling through the cracks after COVID, right? So thanks for doing that. Thanks for being on the check-in. Our goal is to raise awareness, to educate, and to help people. But the interesting thing is when Kenya texted me about it, and I said, sure, have her come in and let's get a CT scan and see what we have. And as you know, I had just gone out of town.
Right.
And at the last moment, I thought to myself, you know what? Let me call my office and say, while LadyLuck is there, let's get some blood tests on her as well, which was a good thing that we did.
Right.
Because I think, as I told you,
I almost died. So the reason why I call them Saint Puma and Saint Kenya is because when ignoring it, I guess we make excuses. I made excuses for how I was feeling, my condition. So when I was tired or when I was in the gym and I wasn't able to work out, I was like, well, maybe because I haven't worked out for so long. And I hadn't been to the doctor. Like I said, I just lost my mom. So grieving is a really, really big thing in our life right now. So I wasn't focused the way I needed to be. And I feel like calling you guys saints, because if I didn't mention it to Kenya, she wouldn't have never made a call. Even though I came here and I had the interview, it's not something that I was always sharing. On the side, we were working on, ordering herbs and things of that nature for fibroids, because you would be amazed to see how rampant it's running through the community. So I know, and just the hip hop field, so many females dealing with it. It's battle rappers who had to cancel because they had this. And I'm on the phone with people. It's like an epidemic. Back in 2014, when I had the surgery, not too many people I knew had fibroids. But now it's like every 3 out of 6 females I speak to. Either someone has a heavy menstrual cycle or somebody just had surgery or on their way to surgery. So when you guys called me and told me everything, I cried, because I've been dealing with this and I suffer monthly. I suffer. And there's been times I wanted to call 911 because I've suffered with pain. So you guys, when you guys called me, and Kenya, you really just took the lead on this. And I might cry again. I'm not gonna mess up my makeup, but I really appreciate it.
Well, can I share something with you? Like, God loves you so much, right? And here's how I know, is that I was so tired that day because we worked and we did the podcast.
You weren't supposed to come to dinner.
I wasn't supposed to come to dinner. It was a last minute invite. And then even when I got invited, I called Amber back and was like, I'm tired. I'm tired. I got to drive home. I got to go far. And I was struggling to whether I should go or not. And I felt in my spirit, God said, you got to go. And I'm always obedient to what he tells me to do. And that's how I know he loves you, because had I not followed that, we may have not had that conversation at dinner, and Dr. Puma may have not come into the fold, right? So it's those opportunities that we get signs for that we have to be obedient to, because you don't know what's on the other side of that. So
my angels, they told me, they were like, come into the office, we're gonna check you out. We do some blood work. And then I guess they got the labs at 5 in the morning. Carmen, who's another angel, I'm telling you, this place is God ordained. So Carmen, she hits me at 6 in the morning, like, you feeling okay? I'm like, yeah, what's going on? Go to the emergency room now, you're almost dead. And I turned to my fiance, I said, baby, I do feel a little lightheaded. She's like, oh, you're just probably all in your head. So then when we get to the hospital, and they were telling me that my hemoglobin was a 3.2 on the phone, but a 3.4 by the time I got there, beet juice. And everybody was amazed. They're like, we don't know how you're not dead. We don't know how you're not in cardiac arrest. And I thought that was amazing that I'm still here. And these two right here saved my life. So I am extremely thankful. And I don't know how to express my gratitude.
You're being very kind and very generous. But I will say, and I told you this afterwards, I've been practicing for 35 years. That was the lowest blood count I had seen in a live human being. I mean, I don't know. The rest of your body must be really strong and in really good shape that you were able to. I mean, it's not like you were sitting home all day. You were out
doing
shows, doing podcasts, right? And it's just amazing. And in that emergency room visit, we were able. You got 4 units of blood.
Yes, vampire.
Right. Now feeling better.
You won't believe it. Before I was saying that my fatigue was attributed to being overweight or lack of vitamins. So maybe that's why the other part of me is so healthy, because I have everything. Sea moss, oil of oregano, we have this, we have that, we have everything in the house. So maybe that's what it was. But I don't know, Doc. You guys saved me, so you're trying to give me credit. But if you guys didn't tell me to come here and you checked my levels, I'll be honest with you, I wasn't going to handle it until I got back home to Georgia. I knew I had to.
Well, I knew that because we had that little argument on the phone about that.
Yeah, I was like, you know, but I was going to handle it then, and I don't think I would have made it home. So.
Well, we're glad you came in. You know, a couple of points. Just a couple of things to know, because your story, like I said, is actually more common than you think. It's actually 3 out of 4 black women by the time they're 50 have uterine fibroids.
Wow.
And a uterine fibroid is just a benign tumor. The problem is they can grow pretty big. They can cause abdominal discomfort. They can cause sexual dysfunction. But worse, when they start to bleed, it could either be heavy periods or bleeding in between periods. And your blood counts could get quite low, as happened to you. And I think what we want to prevent, right? You had a myomectomy, which is a procedure where they just try and, kind of like a D&C, where they just try and scrape away the fibroids. But many women end up with a hysterectomy.
Yeah.
And I don't know why in this day and age anyone should be having disfiguring surgery. I'll be honest with you, I don't know why we would even consider for women hysterectomies, or why we're so cavalier about it. You know, oh yeah, just take your uterus out. I think, you know, if we tried to talk that way towards men, we'd have a whole different conversation, and it'd be a whole, right? I mean, it'd be a whole
correct
different.
me if I'm wrong though. And my understanding about fibroids that are diagnosed like on a gynecological, am I saying this right?
Gynecologic.
Yes, level. It's typically the gynecologist is like, you have this. They're not really the experts when it comes to treating fibroids, so that immediate recommendation is a hysterectomy. In your case, it was another procedure, right? And what's interesting is that hers grew back. So why, when somebody has a procedure like that, do they grow back?
Well, because they can come back.
Right, and I attribute it to my diet. Now, because I knew that they came back, I maintained a diet for a certain amount of time, and they were at bay. But then when I let myself go, that's when they were enraged. And there are things that I believe that I was eating or consuming that were feeding them.
Like what?
Alcohol.
Okay.
You know, just different snacks and things of that nature. When you know, and not taking the vitamins that I'm supposed to, and just not really paying attention to them. And, you know, eating whatever you feel like, you know, the fried chickens, the things that aren't good for us just in general. So I definitely know that they inflamed them.
Well, I'm curious though, other than, you know, you felt kind of your belly getting bigger, where you had to have been bleeding a lot. Was it just heavy periods, or? Okay,
so I would use one of the overnight pads my first day or two. The overnight pads, I run through them an hour. Sometimes,
1 hour.
Sometimes shorter than an hour. So yes, losing a lot of blood. But I got used to it. You know, I've been dealing with it for years. Yeah, so, you know, and the clotting is crazy. I was with one of my friends last night. She's a veteran, and she's dealing with fibroids as well. So we're sitting here at the table and we're swapping these grotesque stories, but, you know, it's what we're both dealing with. And I just know that there's so many other people who are not speaking out about it, and for lack of education and lack of knowing that someone like you exists, because it's a $48 billion a year industry. I looked it up because I'm like, why are they just so quick to tell me they're gonna just take it away from me? And they've done that to so many different women.
Well, I think part of it, and to answer your question, Kenya, you know, the diagnosis is usually made in the GYN's office, usually when they're doing the pelvic exam, and sometimes they'll do an ultrasound in the office and they can confirm that it's there. But GYN doctors are actually very skilled. The problem is so much in medicine is segmented, right? Or fragmented is probably a better word, because there's more than one way to treat them. What we do is we do a procedure called uterine fibroid embolization. And just by putting basically an intravenous in one of the arteries in the wrist, we'll actually put a catheter down into the arteries that are feeding the fibroids, and then put these little beads in that clot those arteries off. So over a period of a few weeks, the fibroids shrink, but because there'll no longer be a blood supply, they'll stop bleeding. And so over a few weeks, what you should experience is that bloated feeling that you have in your belly will go away. It'll almost be like, almost kind of like magic of it slowly shrinking away within 4 to 6 weeks. And because there's no blood supply there anymore, those fibroids won't ever grow back again. Okay. Now that doesn't mean in the uterus you can't get additional fibroids. Okay. That's part of life, but the major problem will be gone.
Amazing.
It sounds a lot better than hysterectomy.
It's a lot better than a hysterectomy. The procedure will take 30 to 45 minutes. You'll be up on your feet within 2 hours. We have an anesthesiologist there giving you sedation, so you'll sleep through it. It's not general anesthesia, it's just sedation. And this should solve your problem. And when we recheck your blood counts in a few weeks, they should hopefully be normal and not wake me and Carmen up at 5 in the morning, and,
I promise.
and we won't have to wake you up at 6 in the morning.
Question, what's the recovery time like with a procedure like this?
You'll be back to normal activity the next day. That afternoon, we'll just tell you go home and rest because you'll have gotten some Versed, fentanyl intravenous, maybe a little propofol. These are conscious sedation, so you'll fall asleep, okay? But not general anesthesia. But you'll probably just feel tired having gone through the procedure. You might have a little discomfort. We give you a little pain medication, but the following day, you can go back to normal activity.
And you're, if I can, correct me if I'm wrong, are going to be the first UFE that we're going to actually document, right, as part of this, show that we're doing, because we want to make sure that, yes, we're educating people, but we kind of want to show them and take the fear away from the procedure. So you're our first.
Well, I'm the spokeswoman. I was thinking about getting Soaring tattooed on my forehead. I don't know if you remember when Blueface did it, somebody gave him a watch, because you guys literally saved my life. Like, and you don't have to take credit for it. You can say, oh, and be pretty and humble about it, but I'm telling you, I wouldn't have done the things that I needed to do at that time because I was so consumed with everything else going on in my life. So I want to share this information. I want to scream it from the top of a mountain because I know so many other women who are dealing with it, and I want to at least be able to help them and share that with them.
Yeah.
Well, LadyLuck, since you came into my life, you've enriched it. So we're really
We're grateful
pleased
for you.
and grateful.
Yeah.
Absolutely.
And I'll make one correction. God saved your life. We were just the vessels.
All right. Well, okay, fine.
Let's
so
give him credit.
I gave all credit, but we all have the ability, and that's what He's given us.
1000%.
Right. And we've done these jobs, and we're doing the work out here in Kenya. You're just knocking down doors. You're saving so many people's lives. So I have to call you Saint Puma
Okay.
and Saint Kenya.
Well, thank you.
All right.
Thank you. Thanks for joining us.
Thank you so much.